cause COVID-19. So, what is COVID-19? COVID-19 is an official name for coronavirus infection diseases. Track your symptoms. COVID-19, fever, dry cough, difficult breathing, fatigue.
Dear friends, members, volunteers, and donors, I hope you are all doing alright with your families in this situation. I'm the CEO and founder of TOHA. TOHA stands for Talented Orphan Healing Aid, that is operating in Nakivale refugee settlement, southwestern Uganda.
The outbreak of the novel coronavirus COVID-19, a highly transmissible respiratory disease, in China in 2019 has been declared a pandemic by the World Health Organization. This situation poses a serious public health risk to communities around the world. One made all the more worrisome by the lack of a vaccine to treat COVID-19. The federal government in Uganda is working closely with state, local, tribal, and territorial partners to respond to this situation. More than 1 million cases of COVID-19 have now been registered worldwide. There is currently no treatment for the disease, and health systems around the world are becoming overstretched. The government of Uganda has declared that the COVID-19 pandemic has reached in Uganda and has taken measures alongside state and local partners to protect Ugandans from the spread of COVID-19. Then, Talented Orphan Healing Aid, a community-based organization that provides support to vulnerable people, PSNs in Nakivale refugee settlement, is deeply concerned by the spread of COVID-19. The economic consequences of the pandemic have presented a number of challenges to native-born citizens and refugees alike in Uganda. The World Food Programme officially declared a reduction in donations and cash assistance provided to all refugees in Uganda. These cuts may result in an increase of malnutrition among refugees and render them especially vulnerable to COVID-19 and other diseases. A particular concern the prospect given to the poor state of medical facilities in Nakivale refugee settlements. Realizing the impact of COVID-19 in Uganda and the concern about the effect of cuts to refugees' rations and financial assistance, TOHA has resolved to address the COVID-19 pandemic by conducting a home-to-home COVID-19 awareness campaign. This campaign seeks to promote hygiene and sanitation, which are the only reliable ways to prevent the spread of COVID-19, according to the World Health Organization. Due to limited funds, TOHA will utilize local available resources to help community members construct hand washing and sanitizing facilities. TOHA has four main objectives: to help people with special needs construct hand washing facilities at the house level, to set up hand washing facilities in public areas in the community to allow passers-by to practice proper hygiene, to promote hygiene and sanitation in the community by providing sanitizers to our target beneficiaries, to provide printed handouts to local community leaders in language understood by residents of the community.